The decision to cut federal funding for mRNA vaccine development could dramatically weaken the United States' ability to respond to future health crises, and many experts warn that this move might do more harm than good. The core of the issue is whether abandoning or scaling back support for cutting-edge vaccine technology compromises national security and public health resilience, an argument that becomes even more urgent in the context of ongoing and emerging biological threats. But here's where it gets controversial. While some officials justify the shift by claiming it's merely a scientific reevaluation, critics argue that it's a dangerous step backward that could leave the country vulnerable. And this is the part most people miss: the profound impact that government investment, or lack thereof, has on innovation, preparedness, and swift responses to pandemics. This week, President Donald Trump praised Operation Warp Speed, a groundbreaking public-private partnership that accelerated the development and widespread distribution of mRNA COVID-19 vaccines to an unprecedented degree. He called it one of the most incredible achievements in our country's history. Yet, just a day later, the Department of Health and Human Services announced the cancellation of $500 million allocated to further mRNA research, indicating that no new projects will be initiated under the Federal Biomedical Advanced Research and Development Authority, BARDA. This policy shift has sparked alarm among vaccine experts and epidemiologists alike, who emphasize that such a move could severely limit the nation's capacity to develop new vaccines rapidly during future outbreaks or bioweapons threats. Adding fuel to the fire is Secretary Kennedy's controversial stance. Kennedy, who has a complicated history with vaccine misinformation, stated that the decision was rooted in expert scientific opinion. Though many scientists and health professionals dispute his claims, Kennedy argued that mRNA vaccines are unsafe, ineffective, and even unethical, a narrative that many see as dangerously misleading. His remarks have caused concern that it might undermine trust in vital vaccine technologies and dampen ongoing efforts to improve vaccine platforms. Kennedy's announcement emphasized a shift toward investing in alternative vaccine methods, such as traditional whole virus vaccines that use weakened or inactivated strains to prompt immunity. For example, while China developed a whole virus COVID-19 vaccine, studies revealed that it didn't match the effectiveness of mRNA vaccines, often considered more versatile and adaptable. Dr. Cynthia Leifer, an immunologist at Cornell University, compares abandoning mRNA research at this stage to partially demolishing a kitchen and then stopping the renovation. You're left with a costly mess and no working kitchen. The unique strength of mRNA platforms lies in their speed and flexibility. Dr. Jennifer Nuzzo, an epidemiologist leading the Pandemic Center at Brown University, emphasizes that mRNA vaccines are particularly suited to counter unpredictable pathogens, changing quickly due to their technological design. Unlike traditional methods, such as growing viruses in eggs, a process that can take months, mRNA vaccines can be manufactured within days. They work by introducing messenger RNA, a simple genetic molecule, which instructs cells to produce proteins that activate the immune system without the need for cultivating live viruses. However, critics warn that pulling back on this research is a clear mistake. Dr. Michael Osterholm, Director of the Center for Infectious Disease Research and Policy at the University of Minnesota, calls the move one of the worst public health decisions in decades. He points out that vaccines represent only a tiny fraction of the pharmaceutical industry's profits, and it's largely government funding that drives innovation in this field. Without ongoing investment, the future of mRNA technology and its potential to prevent or contain pandemics remains uncertain. Osterholm warns that the current climate of support cuts creates a dangerous precedent. Were another pandemic to emerge, the U.S. might find itself at the back of the line for vaccine access, just as other countries gain ground in vaccine development. Nuzzo adds that reduced investment in mRNA technology not only hampers preparedness, but might also embolden malicious actors. Defense experts often regard robust biological research and vaccine readiness as vital deterrents against bioweapons activity. A retreat from this front could signal weakness to adversaries and undermine global security. Some leaders in the Trump administration have made efforts to bolster domestic manufacturing of pharmaceuticals. But experts fear that these cuts to mRNA vaccine funding could have the opposite effect. Dr. Katalin Karikó, who was awarded the Nobel Prize in 2023 for her foundational work on mRNA technology, recently expressed concern. She shared that she moved to the U.S. from Hungary because of the country's emphasis on innovation and scientific advancement. Now, she worries that a lack of sustained investment could push the next generation of scientists elsewhere, weakening America's scientific leadership. When the future pandemic inevitably arrives, other nations may be better prepared or quicker to develop effective vaccines, leaving the U.S. at a disadvantage. This situation raises a critical question. With ongoing shifts away from innovative vaccine platforms, are we risking not only our health security, but also our strategic standing on the global stage? And perhaps most provocatively, should economic and political considerations truly take precedence over the investments necessary to protect millions of lives? What do you think? Is this a short-sighted move that could set us back decades? Or are there valid reasons for reevaluating how we prioritize vaccine research? Share your thoughts below.